video, we're going to be talking about the suboccipital triangle as well as these suboccipital muscles. The suboccipital triangle is named after the nerve or the suboccipital nerve that we find within it. And that suboccipital nerve is the DPR or dorsal primary ramus of our C1 vertebra. It provides primarily motor innervation and therefore it innervates these suboccipital muscles, which is why the suboccipital muscle group is named what it is, just like the suboccipital triangle is named what it is, both after the suboccipital nerve. The suboccipital nerve is accompanied by the vertebral artery, specifically the third portion of the vertebral artery within this suboccipital triangle. Now, to understand what the third portion of that vertebral artery is, we have to understand all four parts. Now, the first part of the vertebral artery exists as it branches off the subclavian artery up until right before it enters the transverse foramen of our sixth cervical vertebra. Therefore, it is termed the preforaminal portion of the vertebral artery, or the V1 portion of the vertebral artery, just implying that it is the first portion. The second portion of the vertebral artery is right whenever it enters the sixth cervical transverse foramen up until it exits the first cervical transverse foramen. Therefore, that portion is called the foraminal portion, or the second portion of the vertebral artery. The third portion exists right after it exits the transverse foramen of C1 or our atlas, as it kinks around the posterior arch of our C1 atlas, forming a groove for the vertebral artery, and as it begins to ascend, right before it enters the skull through the foramen magnum. So the third portion exists right after it exits the first cervical transverse foramen and right before it exits or enters, the foramen magnum. The fourth portion of the vertebral artery exists as it enters foramen magnum, or it enters the skull, up until it forms with the other vertebral artery, or combines with that other vertebral artery to form the basilar artery. Those are the four different sections, or the four different places that demarcate the four different segments of the vertebral artery. Therefore, that's why the third portion of the vertebral artery is within this suboccipital triangle with that suboccipital nerve. And if we look here real quick, we can see that groove for the vertebral artery that exists on this C1 or atlas vertebra. Now, what's unique, or weirdly enough, about that vertebral artery is that it does not perfuse the suboccipital muscles. These suboccipital muscles, although they are innervated by the structure found within the suboccipital triangle, are not perfused by the structure found within the suboccipital triangle. The suboccipital nerve innervates them, but the occipital artery perfuses them.